Good evening and welcome to this edition of I Am Dedham, sponsored by the Dedham Human Rights Commission. I am Sergeant Sullivan with the Dedham Police Department, and I am the representative of the Dedham Police Department on the Human Rights Commission. I have previous experience as the school resource officer, and I'm currently assigned to the midnight shift for the Dedham Police Department, and I am a Dedham resident. This segment is about the mental health resources available and the substance use resources available. And our two guests today are Emily Turnbull from Riverside Community Care, which is our mental health provider for the town of Dedham, and Jessica Tracy, who is our public health nurse, who works for the town of Dedham Public Health Department. And these two resources are available to any Dedham residents. And it's important to talk about this because a lot of times the notion is that when you call 911, the police department will show up and they'll arrest that person, but that's furthest from the truth. We have a lot of available resources in the community, and it's all about preventive policing. So when someone does call 911 who has a problem, we are problem solvers, and we're there to find alternative solutions to arrests. And so these are just some of the two programs that we'll highlight today and that we'll talk about. But we also have other programs out there for preventative policing, such as our school resource officers, which has the goal to develop positive relationships with kids. We have our Silver Alert program, which basically is run by Officer Colley, and it helps with people who have Alzheimer's, dementia, and potential wandering. We have a community partnership with our Dove Advocate. Dove stands for Domestic Violence Ended, with our Dove Advocate, Sarah Kinane. We have a prescription drug disposal program for unwanted medication. And of course, we have a community resource dog, or a comfort therapy dog, which provides emotional support for people in the community. So first, we'll start with talking with our Riverside clinician, Emily Turnbull. So please tell us about your role as a Riverside clinician in your role within the Dedham Police Department.
Yep, so back in 2003 in Framingham, they noticed that there was a gap in the policing where they were finding that there was a disproportionate amount of people with mental health issues and substance use accessing the police for various reasons. So they set up something called a Jail Diversion program. This program embeds a clinician, a master's level clinician within the department to help respond with police to any mental health concerns and try to find resources and signposting in the moment when the crisis is taking place with that person, and if necessary, follow up with that person after the event. So it's kind of spread across all the different towns in the area, and I'm Dedham's.
Yes. Can you just explain a little bit about how you work part-time between Dedham and Needham, and kind of like what your hours are, and our co-response with if someone is having a mental health crisis, how you respond with the Dedham Police Department?
Yeah, so I split my time 50-50 between Needham and Dedham. My hours are usually afternoon to evenings because that's when they've noticed the main influx of mental health calls. What would normally happen is a 911 call would come through and the dispatchers would send the officers and potentially the sergeant out. Then if they felt that it warranted a mental health call out for me, I would respond to that scene. Sometimes I will go with the officers in kind of real time, sometimes I'm a few minutes behind. And from there I'll do a mental health assessment whilst the officers are present, and figure out whether they need any high level of care at that moment in time. So it really depends upon the situation, who's around and things like that, but that's usually how it works.
Perfect. And just from our role as police officers, we want to make sure that person who is having the mental health crisis is safe, and want to make sure our Riverside condition is safe. So we want to do a good job with that. What kind of services do Riverside Community Care provide?
Yes, so I work for Riverside, which is Riverside Community Care, which is a non-profit. They work with mental health, behavioural health and human services as an agency all across the majority of Massachusetts. They provide different levels of care. So my role is part of the MCI, which is the Mobile Crisis Intervention Service, which is where they go out to offer same-day mental health evaluations. But they also offer things like CCS, which is Community Crisis Stabilisation, which is a very short-term but intense stay, usually 4 or 5 days, to prevent people from going to inpatient with the hospital or as a step down after hospitalisation, just to kind of stabilise them, ready to kind of go back into the community. We also offer in-home therapy, there's outpatient support, and one of the best things about Riverside is they have a lot of peer-led support. So we have recovery coaches who've had substance use themselves, we have family partners and peer specialists who have dealt either themselves or family members who've had lived experiences with mental health. So it's a big combination of lots of different services.
Thank you. And could you please just talk a little bit about the Section 12 process and what is Section 12 entitles and that criteria, which what makes a Section 12 a tool that a police department or a clinician can use?
Yeah. So a Section 12 in Massachusetts is what people would kind of refer to as the psychiatric hold. It's used, it can be used by various people, independently licensed social workers, doctors, police officers, and it's essentially a tool where if there is imminent risk of harm to that individual, it can be used so they involuntarily go to the hospital for further evaluation. There's 3 kind of areas where it works. The first one is if they're immediate risk to themselves. The second one is if they're at risk to other people. And the third one is if somebody feels that they don't have the right skill set or judgment at that point in time in order to maintain their safety. In which case the police officer or the clinician at the time will then write out the section and they'll go to hospital for further evaluation from there.
Perfect. Thank you very much. And just from experience, like myself or Emily can talk about how people, we use the Section 12 on people with a likelihood to either self-harm or harm others. A lot of times if you see someone who might be experiencing a mental health crisis walking down the street, just talking to themselves, that's not a situation where we're going to send a police officer out and Section 12 that person because there's no likelihood to self-harm in that situation.
Absolutely. It's kind of that imminent risk of harm.
Perfect. Thank you. And then just finally, can you just talk a little bit about the mental health stakeholders meetings that you monthly attend along with members of the Dedham Police Department?
Yeah, so it's a really good tool. We attend monthly. It's the Chief of Police goes. There's a lot of town members. There's people from housing, public health, the elder services, and we all come together to talk about either services in general or specific people we've come across to try and see if they're in touch with those resources or if there are resources that we can offer for them. So it's kind of putting everyone's head together to come up with a plan of action, and it's been really successful. It's been running for a while now, and the team keeps growing, which is always good. So that's the best way to kind of utilize the services in the area.
Perfect. And I used to be part of those mental health stakeholder meetings as my role as the school resource officer. And we just have a ton of people that come to the table because we're seeing people in crisis and we're trying to outsource that into the best available resources. So thank you, Emily, for joining us, and that was very informative. This is Jessica Tracy from our public health nurse from the Department of Health. So please tell us a little bit about your role as the public health nurse and your role within the Dedham Police Department.
Sure. So I started with Dedham as the public health nurse in 2015. Around 2013 to 15, in that time period, a lot of towns and communities were developing drug coalitions, substance use coalitions to respond and better understand the opiate epidemic that communities and the nation was facing. So when I came on in 2015, 8 of my working hours was to facilitate the, at the time, the Dedham Coalition for Drug and Alcohol Awareness, to do like harm reduction strategies, understand how to reach people in the community, things of that nature. So as I worked with different coalitions in the immediate area and working with the community in our coalition and thinking about strategies that are effective for harm reduction, so preventing and responding to opiate overdoses. One of the strategies was to conduct home visits after an overdose event. So originally I did that with representative from the district attorney's office, and then conducted those home visits with former Officer Sullivan, now Sergeant Sullivan, and now I conduct those with Officer Jenkins. So I still do home visits, which I, if there's an overdose event, I would go out with an officer and do that home visit, providing resources, things like Narcan, important numbers, and try to have conversations with families or people who were affected, the individuals themselves. And so that's kind of my role as the public health nurse in that capacity. And that's just like one portion of public health nursing. But, I've personally bombarded Emily during our mental health stakeholders meetings, when working with community members who might have additional needs. I've called Riverside and they'll come out and do a home visit if they're available for somebody who may not need hospitalizations but is in crisis mode. So I'm just plugging that right here because I think that's a very valuable service, not only to me as a public health nurse, but for the police department as well. So it's really about those partnerships and relationships to really respond to the needs of the community, whether it's substance use related or mental health.
Awesome. Do you want to just talk about some of the services or resources available that you offer on overdose follow-ups?
Yeah, so I have this bag. So what happens is the officer will contact me and we'll go out and do the home visit. And in this bag I have, you want me to demonstrate that?
Absolutely.
I can demonstrate that. So there's a lot of good resources in here. And just to be clear, you don't need an overdose event to get this bag and these resources. You can always contact me at the Dedham Health Department. And these are free and available to our Dedham residents. So, of course, we have a whole host of information in here, important numbers, some of them including the police department. If you have unused medication, they have a kiosk in the lobby that got transferred over with the new building, right?
Yes. Yep.
Yeah, so that's there. It's open 24/7, no questions asked. You just put it in there.
Take back program.
Yep. Oh, good, good. And of course, information about Narcan. There is some information in here too. Emily talked about Section 12, but there is Section 35. If you have somebody who's struggling with substances, that's instead of mental health, you would petition to the court for the court to essentially have the person go to a detox facility or such. And there's free legal advice phone numbers in here. I do have things like Narcan, so we do give Narcan, which is also available in my office free. So if you know somebody who's struggling or want to have it on you, this is something that you can get from the health department. It does look like this. It's really easy to use, and I have lots of information in here about that. We also give out sharps containers. So the police department is unused medications. The health department is sharps. If somebody's using substances and they have needles, they can put them in this container, bring it to the health department for disposal, no questions asked. And then we do have things like rapid response fentanyl strips. So these will test a substance to see if there's fentanyl in it because unfortunately, fentanyl is a very potent opioid that is becoming more and more, I don't want to say more responsible, but the chances of overdosing are significantly increased with fentanyl. And you can use it to test any substance that you have, and there's directions in that. So this is something that I give out during my visits, and I also talk about Learn to Cope. So Learn to Cope is a peer support group that meets at the town hall on Wednesday nights, I believe. I believe it's Wednesday, but it's on the website, the Town of Dedham website, Learn to Cope, and on the calendar. So you can find it there, or again, you can call me at the Dedham Health Department. Either way works. But, you know, just to know that if you do have somebody who's struggling, you're not alone. And there are peer support groups that meet in Dedham. They do meet in other towns too if you're not comfortable coming to Dedham or Town Hall. So there's, you know, there's so many resources out there. But what we found is with the resource list also comes the challenges of trying to call every number on that list for help, right? So two things, or three things really, that we plug for services is one is the helpline for substances. So basically, and that's in my bag as well and on our website, if you are struggling with substances, you call that number and you say, hey, I'm a male or female or other, I'm looking for a detox bed, and this is my insurance. They help you find what you need at that time, whether it's detox, outpatient services, et cetera. So that's for substance use. The state also has a similar number, which is available in my resource list, but there is also something called Interface, which Dedham pays for, which is another service. You call, you say what you're looking for mental health, you give them your insurance information and what you have, and they do the work for you. Because we know we're all busy, and when you're calling a bunch of numbers and you need help, and everybody says, I don't take that insurance, or I don't have a bed, it can be very defeating. So we really try to stick to a few resources to get what you need.
Perfect. Thank you very much. And just to kind of reiterate, when a person does overdose and they're calling 911, the Dedham Police Department is going to respond. The Dedham Fire Department is going to respond. We use as our emergency services provider as Coastal. It used to be Fallon, but Coastal will respond. And those people are going to respond, and we're going to provide that care. And there's something out there that's called the Good Samaritan Law. And we'd rather have someone call 911 and get help as opposed to saying, you know, not call 911 because they might feel that they might be charged with a crime. So the Good Samaritan Law says that, you know, if you call 911, you can't be charged with possession of certain drugs in your possession when you call that. But that gets the ball rolling. And the Dedham Police Department's Officer Jenkins maintains what's called a critical incident management system. And that's through the police department. So if a person overdoses, or Dedham resident overdoses, say in the town of Norwood, in the past, Dedham wouldn't know about it unless a Norwood detective reached out directly to a Dedham detective and said, hey, this Dedham resident overdosed. But now that Norwood officer is going to enter that information into this critical incident management system. Officer Jenkins is going to get notified, and that's going to get the follow-up started with Jessica and Officer Jenkins. And we try to get that out there within 72 hours because we know that there's a critical time period for getting people resources because it's fresh in their mind. So if you overdose on a Monday night, evening shift, Officer Jenkins might get that information on Tuesday morning, and then that ball gets rolling. So then she'll schedule a drug overdose follow-up with Jessica and herself, and she'll bring our community resource dog, Ruby, because she's a good icebreaker, and she establishes those relationships with people. So thank you, Jessica.
Yeah, and I would just add, you know, with the home visits that I do and, you know, all the harm reduction strategies that we have done, you know, the stigma is real, but it's decreasing, which is great because it allows opportunity for people to seek treatment and it allows families to heal from that trauma. You know, in my home visits, I've been to every precinct in Dedham. There's not any particular area that I'm visiting more than others. So, I just wanted to share that information, and just a reminder that, my office door is always open, and it doesn't matter who you are in Dedham, you can always come talk to me and get those resources.
Thank you very much. So thank you, Emily. Thank you, Jessica, for spending this evening tonight and plugging those resources available to Dedham residents. Much appreciated. Just wrapping up, there is a community picnic and town culture night on Wednesday, August 23rd, which is sponsored by the Human Rights Commission. That's going to be at the Endicott Estate. And I would like to mention that the police department is involved in a national campaign. It's called National Nights Out. And the goal for National Nights Out is to get community engagement. And so that starts on Saturday, July 29th for the Dedham Police Open House at our brand new station. So anyone can come by and check out the brand new station. And then on Monday, July 31st, there's a Oakdale Square ice cream social. And then on Tuesday, August 1st, there's an outdoor movie night at Condon Park. And then on Wednesday, August 2nd, there's some tie-dye fun at the Endicott Estate. And then also on that Wednesday, August 2nd, there's a Flashlight Manor neighborhood walk from 7:30 to 8:30. There's a Blue Bunny event for story time with the theme being public safety. And it ends on Thursday, August 3rd for a Riverdale neighborhood hot dog and ice cream social. So we try to incorporate a lot of different events for people to come out, interact with our officers. A lot of our officers are Dedham residents, and you'll probably see us around town, either at sporting events or different events that our kids or family members are involved in. So please feel free to come and talk to us at any time. Thank you for watching this segment of I Am Dedham, and hopefully you can catch some episodes in the future.